He literally would have had to have a transplant in the middle of the podcast without anybody ever noticing.
This is, a clear example of a hair transplant.
This guy is 100% and is going to need to be shaving it pretty damn soon.
Definitely looks bald right now. Hey guys, Dr. Gary Linkov here of City Facial Plastics in Manhattan, New York. We're going to do another reaction video, so make sure if you enjoy it to like, comment, and subscribe to the channel. So today's reaction video is going to be based off of a video by More Plates, More Dates. A guy named Derek has a pretty cool channel. And I put out a video that was called I Was Wrong About Logan Paul's Hair Loss Reversal. And towards the end of the video, he actually says, he doesn't know much about hair transplants, and he's trying to figure out, did Logan Paul have a hair transplant, or how did he get his hair to be better and more full and that sort of thing. Let's watch the video together, and I'll make some comments along the way.
Fat and bald. Just take one trip to Turkey, you'll be good.
We might go to Turkey.
I'll come with you guys.
Yeah.
So right off the bat, they're talking about going to Turkey. I'm assuming they're referencing, hair transplants and how that gets done in Turkey. People definitely travel for hair transplants. Some will go to Turkey, some will go to India as another big center, South America if they're trying to basically find a cheaper type of hair transplant. They basically charge less per graft and for the whole procedure in some of these other countries compared to here in the States. There are some very good clinics in those other countries, but you have to be very careful. Sometimes the hygiene standards are different. If something goes wrong, what are you going to do that now you're back, in the States and you have an issue? So you just have to be careful, and also it's hard to know exactly which clinic is best, because you can do all the research you want online, but if one place is marketing things better than another, then you might get drawn to the wrong place. And so just have to be careful with traveling out for any kind of plastic surgery, but especially hair transplant.
You don't need to go to Turkey to get a haircut. You could just do it in LA. I know people.
What's up guys, Derek, moreplates.com. Today we're going to be talking about Logan Paul again and his hair transformation. So I did a video a while back in May called How Logan Paul Reversed His Hair Loss, and basically I talked about how over the span of a couple of years he went from what appeared to be, to me, well on his way to being like his dad. You see here his dad is very, thinned and receded to the point where you would just call him straight up bald.
The dad definitely looks bald right now. There's a classification system when you're talking about hair loss, the Norwood Hamilton classification system. So his father would be at one extreme, Norwood 7 of that spectrum. Logan, in at least this picture, it's hard to tell because he's got this hairstyle where it kind of falls forward, and so you can't really judge the hairline well. So maybe they'll have some other photos of him during this video, and we'll be able to kind of give a better assessment of what's going on.
Logan, as a young guy, you can already see significant recession and thinning even in his very early vlogs, where you'd be like, this guy is 100% fucked and is going to need to be shaving it pretty damn soon.
Couple of thoughts on that. Some people do recede and thin out earlier, in their lives. But what happens in many people is that the hair loss that you get eventually will stabilize for the majority of people. And that can happen it can stabilize for 5 years, for 10 years. So just because you're thinning at an early age and receding doesn't mean that you're on your way to shaving your head, the following year. What Derek is saying, you just have to kind of keep in mind that there is a more kind of scientific basis for some of this, and just really natural history of hair loss is a little bit different in the majority of people.
Logan had some very obvious shots where the recession was getting severe and the hair loss was getting really bad, and then at the start of his podcast, his hair was pretty, wispy, thin, etc. And over the span of the podcast, his hair density sort of evolved. So, it was always, he's always talked about his receding hairline before too. He's very open about it.
And I actually really love that Logan's so open about the recession and sort of the changes with his hair. Recently did a podcast with the fabulous Lauryn Hill, and in that podcast we talk about how a lot of celebrities, they're hiding the fact that they get different procedures and surgeries done. So it's nice to see that some celebrities are very open about their situation. I think it helps sort of the rest of us, the rest of everyone else, people who just happen to have these same issues, to kind of cope with them and see that there are things that they can do to make it better. So I applaud Logan Paul and Derek for bringing that out about his willingness to share.
He's self-deprecating in that regard, and he's even done the cornrows thing before.
So I don't know if this cornrows hairstyle was something that he wore for a short period of time or a prolonged period of time. But you have to be careful with these tight kind of hairstyles. They can actually promote further hair loss because of the inflammation that's caused. If you have a hair follicle and you have a strand of hair and you're pulling on that strand, you develop inflammation at the root of that follicle, and then ultimately if it's stressed enough, it tends to fall out. So it's just something I don't think he wears this hairstyle much, but for sort of everyone else out there, tighter hairstyles can promote further hair loss.
Said how he looks like a thumb when he pulls his hair back and he like shows the how receded and thin he is.
No, I look like a girl. No. No. Oh, this makes me nervous. Last time I did this, I did cornrows, and I look like a thumb. I look like a fucking thumb. No.
Yeah, so he's pretty you know, okay with talking about it, I guess. And then throughout the podcast, you know, his hair was still like maintaining that thin, wispy look. It was like down and styled over to hide his, you know, recession and his thinning. But it turns out it may have also been, well, it's not like he ever doesn't style it like that.
I do see what Derek is talking about in that the hair appears more full in this shot here at 237. It is his hairstyle to kind of wear it down. And so it's hard to tell, you know, how much intervention he had, whether surgical or non-surgical, to get to this look. I mean, the hair color is different. The hair can appear more full sometimes, even with changing your shampoo, you know, things like that that are sort of more natural and are in pharmacologic or surgical interventions. So it's not like a dead giveaway just looking at his hair in this frame. Keep in mind that if the hairstyle were different, we might be able to learn a little bit more about what may have created this fuller look.
Thin, wispy to slightly denser until like in the peak of the podcast, it just had like much better density. And a lot of people commented and were basically saying, no, he didn't. My assessment was, I thought he got on a hair loss prevention regimen, like a significant one, like MINOXIDIL plus FINASTERIDE, or like when I say significant, like significant for a newbie, that was a pretty significant regimen. And I thought he probably got on it, was sort of like past the MINOXIDIL shed maybe at the start of his podcast, and then you started seeing the manifestation of the results.
In terms of MINOXIDIL causing shedding, it's only 15% of patients who will experience shedding, so it's not that everyone who starts MINOXIDIL or Rogaine, as the brand name is, it's not that everyone's going to have this type of shedding from that agent, so just keep that in mind. And he's bringing up some other, you know, medications such as FINASTERIDE or PROPECIA, as it's otherwise called, and that is a pill you take once a day. The MINOXIDIL is a solution, basically either foam or kind of liquid solution that you apply onto your scalp once or twice a day. I find that in general, most of my patients are much happier with PROPECIA FINASTERIDE in terms of results compared to the Rogaine or MINOXIDIL. They just see improved benefit and better hair quality and reduced shed with the FINASTERIDE.
The results later in the podcast, because again, remember, this is him way back years ago, like far, like early 20s. He's like 25 now. This was like 21 years old or something. And his hair looks like this. Like you could tell he's like ready to shave it off, bro, in like a year or two. And then his hair, you know, he would have this frizzy look to kind of hide it. And then throughout the podcast, like I said, he dyed it blonde. The transition was like seamless and so drastic to me. Like it went from like brown to like blonde to like dirty brown blonde with way more density over the span of the podcast.
Aside from the medications that can improve the density, that's on one end, right? You've got the pills and the topicals. On the other extreme, you have surgery and what that can achieve. And then somewhere in between, there are a few other options. The main one being PRP, platelet-rich plasma. I have a number of videos out on PRP and how it's used and what the purpose of it is. And I was on the Dr. Oz show talking about needleless delivery of PRP, but basically taking your own platelets that have growth factors and infusing it into the scalp. So he may have had PRP sessions, and that may also create, you know, fullness, and some people respond really, really well. It almost looks like a transplant result. The biggest difference is that compared to a transplant is that it's transient. You have to keep getting those treatments, but I'm sure he has the funds, and the resources to get those types of treatments. The other type of class of hair loss treatment is laser light therapy. Low-level laser light therapy in the form of a cap like Capillus. There are other companies out there that have these caps, and they provide some degree of improvement. It's been studied. We've got data to support the use of that type of technology to stimulate the hair and also improve the thickness. But you just have to remember that in order to improve the hair when it comes to the thickness of it and just kind of improving its look, with medical therapies, including PRP, you have to have actual strands of hair in that location. Where you no longer have hair, like where it's completely bald, you need a transplant if someone's a candidate for a hair transplant in order to give you hair in that location. So if you were to look at those images that Derek had up on the screen, but with Logan lifting up his hair, then we can really tell if it was a transplant or if it wasn't. Because if in those recessed areas there's still absolutely no hair, it's very unlikely that he had a transplant. Most transplant surgeons and most patients would want to fill that in at least partially. Whereas if it's just increased fullness and it just looks fuller, you just don't know if it was a transplant or not.
My assessment was he probably did a prevention regimen, because frankly, I don't know a lot about transplants, and I didn't think it was possible for him to have, he records every week. He literally would have had to have a transplant in the middle of the podcast recording without anybody ever noticing, and just had it grow in perfectly and have no one know the wiser. I assumed it would be somewhat obvious in some aspect.
This is kind of a loaded point, right? Can you have a hair transplant and go right back to work and not have anyone notice? I mean, that's really the question that Derek's posing here. The answer is yes, for the most part, meaning that of course when you do the transplant you're going to have some swelling because of all the manipulation that's done to the scalp. That swelling over the course of about 3 to 4 days tends to descend down onto the forehead. There are things you can do with the transplant, like putting some steroid into the solution mix that you use to anesthetize this area, giving a patient oral steroid in order to reduce that type of swelling. But once that swelling is gone, there are ways to do a hair transplant without anyone really knowing what had happened. I have a video that talks about the different ways to extract hair for a hair transplant and the different ways of actually putting the hair in. And so depending on the type of method that's used, it's very possible to go back and do a podcast a couple of days later and look like nothing happened, especially if you have a hairstyle that's combed down. Because imagine he received some, hairs from the back into this area where he was receding. Now he's got his existing hairs. They can cover up the area of usually the stubby hairs that are placed with a hair transplant. There's also a method called long hair preview, FUE, which is a way to extract hairs in a long form and move them while they're still long. That's not the most common way of doing FUE or follicular unit extraction, but that is one way to do it, and then you literally look like you just have, your long hairs still there. But there are several methods in which you can basically, go about your business a couple days after hair transplant surgery, and no one really knows, what happened. So I definitely would encourage you guys to watch that other video of mine, and that gives you a lot more information about how the hair is extracted and how it's placed, and ways of basically masking that you ever had anything done.
I might have been wrong. And in fact, he might have actually had a hair transplant somewhere in 2018, 2019 area, that, transition phase between him at the start of the podcast to now where his hair has way more density. I think he got a transplant done. The reason being is because on the most recent episode, he literally implies that he knows guys who do transplants, and he'll hook up Mike Malak with a good transplant doctor essentially.
Keep in mind that I'm a hair transplant surgeon, but I do offer non-surgical options, and not every patient wants to go through a hair transplant. So even if he knows hair transplant doctors, he may have gone to one to do non-surgical types of therapies like the PRP, or received a regimen for non-surgical improvement for his hair. So that's all possible. But of course, I agree here that the biggest elephant in the room is, did he have hair transplant? I could tell you more if we were able to see the actual hairline as opposed to just hair coming down. Still hard to tell.
He's pretty transparent in that he doesn't seem to give a fuck when he talks about, his hair loss is this, is that. He literally has like, talks about, you know, sexual shit like all the time. He talks about Viagra, Cialis, etc. Well, partially because a company that makes it sponsors his channel, but I mean, like, he's pretty open about shit and like pretty transparent. So like maybe he's not going to cover the specifics of I got a transplant, but like it's sort of implied. And frankly, I think that being like reasonably good friends with Machine Gun Kelly, who had one of the most drastic...
Yeah, so let's pause it here at 6:04. And this is, you know, a clear example of a hair transplant. The reason is, if you're looking at the hairline itself, it takes on a whole different shape now, right? So those temporal recessions on Machine Gun Kelly have been brought down. The entire height of the forehead has come down. The hairline has come down. And Logan Paul, at least as far as the types of pictures of himself that are out there, that the way he wears the hairstyle, it's just really hard to tell.
They're all like, you know, connected. And with Machine Gun Kelly, in my opinion, is probably the same doctor who's, you know, doing all these celebrity hair transplants. And I don't think it's a coincidence that Logan Paul's density is like way fucking better. Like, yes, I've showed some hyper responders on my channel that did it with just medication, but a lot of these influencers, you know, they're gonna go like the Botox route, the hair transplant route, the physical surgery route, because they don't understand pharmacology, nor do they have somebody assisting them to learn about it.
You know, the comment there, you know, I just kind of wanted to elaborate a little bit on. So not understanding the pharmacology has nothing to do with what a hair transplant can achieve. You can take all the medications in the world. That doesn't mean you're going to get the result of a transplant. It also doesn't mean that everybody is a surgical candidate. Like I said previously, if you don't have hair in an area and you want to put hair there, it's not going to grow with any medication. You need a transplant. If, however, you're sort of diffusely thin, especially potentially also thin in the donor area, not a good candidate for a transplant, because where are you going to put the hair? If you put the hair sort of everywhere, then you get this diffuse effect and it's not very significant, not very impressive. You really want to concentrate your effort when it comes to a hair transplant into, you know, areas where you can really make a difference. You know, I don't really agree with his point here that they don't really understand pharmacology, so they just go get a hair transplant. Not true. Plus, I'm assuming that they're going to, you know, well-regarded doctors, I would hope, whether it's LA or wherever it is. Those doctors won't just do surgery just because they have a celebrity in front of them and who wants surgery, right? So as a surgeon, we have certain criteria that people have to meet prior to getting surgery.
Like, it just seems like cosmetic surgery is like the instant fix, most aggressive thing that's gonna get the best bang for the buck and and it's like, yeah, you can't really argue with hair transplants. They fucking work.
And also, when you think about the amount of time that it takes for a hair transplant to actually show its results, it's a long time. So it's not very instant. In general terms, it takes about 3 to 6 months after a hair transplant to start to see the hairs growing in. And then you have to wait at least 10 months, a year for the hair to reach some reasonable length and for all the hairs to come in. So it takes about a year to see what you have. So it's not instant.
Probably had a transplant, you know, the transplant doctor probably advised that he take finasteride and or minoxidil as well, probably.
Good point here that Derek makes, because you can do a transplant, but the person will continue to lose their native hairs. The pre-existing hairs in the area that's at risk, they'll continue to thin out and potentially fall out. So it's very important to put people on maintenance therapy with something other than just doing a transplant. So yes, it's true that I advise my patients oftentimes to, you know, be on a medication in addition to getting the surgery, to really try to optimize their results for as long as possible and preserve the hairs that they have, so we don't have to keep doing surgery.
It might be a combination of everything, but to me it was just interesting how his hair basically transitioned throughout the podcast with nobody noticing that he basically got in my opinion, I speculate he got a transplant done literally in the middle of filming without anyone noticing. So anyways, maybe the FUE procedures are that good now that you can just get it transplanted underneath your fucking hair and like nobody notices.
Yes, that is possible.
On a week-to-week basis, even though you just got it done and he covered it up nicely. But to me, I can't see any other way it would have worked. Any of the transplant experts, you know, drop in here. Like, I'm the pharmacology guy. I'm the guy who's like preventative as well as like aggressive recovery with pharmacology, but like actual surgery, I don't know a fucking lot about hair transplants.
See, that's where I come in. This is perfect. This is a segue to this whole reaction video. My summary is that he may have had a transplant. We don't know for sure. There are other things out there like the PRP, like some of these medications that can create a really full look as long as you maintain it. That's the biggest difference. With surgery, but when your hair grows in, by the time that grows in, you're pretty much set unless you start to lose some of those original hairs that you had. With the medical therapies, including PRP and laser light therapy, you need to continue to do those treatments or else you'll lose the effect. That's the biggest difference between medical therapy and surgery.
So anybody who can assist in understanding if this is feasible to do when you are filming like twice a week for a podcast that literally hits you at a million different angles for like an hour and a half straight, like, is that an easy thing to hide with FUE nowadays, or what's the fucking deal? But anyway, it seems like to me,
another point here, and again, my other video goes into a lot more depth about FUE specifically, but keep in mind that even though FUT is a lot less popular these days, that actually, an FUT, just in case people don't know, is actually cutting out a strip of your scalp from the back, cutting it up into each of the grafts under the microscope, and then putting the hairs in, as opposed to FUE where we take out one graft at a time. So with the FUT procedure, guys actually, and women, but you know, since we're talking about Logan Paul, we'll stick to guys for now. Guys were able to return back to work within a couple of days and no one knew that anything was done. Nowadays with FUE, because the reason is you can leave the hair in the back long, you just cut out an area. So you'll have sutures, but you'll have your other hair covering it up. The downside being that ultimately you get this long scar. So if you ever want to wear your hair short, it's kind of an unsightly appearance. But with the FUE, a lot of times people are doing a shave where they're shaving the back, and there are ways of doing FUE without shave, and that's what that other video talks about. But that actually creates, when you're shaving the area, it makes it harder for people to hide that they had anything done with FUE. People like to poo-poo FUT, but it still has a place in sort of the armamentarium of what we offer as hair transplant surgeons. I think Derek did a nice job of discussing Logan Paul's hair changes. We still, you know, don't have a final verdict on this. I do think it's possible that he had a hair transplant, but not 100%. If you showed me the hairline up close before and after, I could pretty much tell you, but because of the hairstyle, we just don't know for sure. Good luck to Logan Paul in his fight against Floyd Mayweather. I think that's super exciting, and I'll be watching. And if you guys have any questions hair related or anything related to facial plastics, I'm your guy. And if you enjoyed this video, please remember to like, comment, and subscribe to the channel. There's more to come.